because we hear the word diabetes, you have to kind of figure out, well, what type is it? What's exactly going on? But for sure, if you hear, if you hear type 1 diabetes, though, for sure that person is on insulin. They have to be on insulin for the rest of their life. They will never not be able to be on insulin. And it's like a very important, this is one of those medical inventions that has saved so many lives, because you wouldn't be able to live without it, right? And so you now have had 2 pregnancies where you've had to, on top of your just daily management of your insulin based on what you eat and your activity level, you're having this fluctuation and this change happening in the 2nd and 3rd trimester where you're having to take, what did you say, like 4 times the amount?
Yes. So I'll provide an example too, but let's just say before I get pregnant, or I would get pregnant, I would take 30 units of insulin total a day. Then in that first trimester, maybe it's 25, so a little less, or maybe 35, just a little bit more. In that 2nd trimester, I can go up to like 60, 70. And in that 3rd trimester, I can get up to 150 or 200 units a day. With the insulin pump, I'm constantly changing the settings depending on where I'm at in pregnancy. And so I could be making tweaks every day, every 3 days, every week. I would say more intensely starting around week like 27, 28 is when you really start to peak the insulin resistance. And then it actually gets a little bit better around like weeks 37 and 38. You see a little bit of less insulin resistance. But I mean, yes, we're just getting a crazy amount of insulin resistance and so much insulin to cover that. And you're just, you're so concerned. You don't want to hurt your baby or harm it or cause any kind of risks, to happen. So you're just like, you become obsessed. I feel like every type 1 diabetic that I've talked to has the best care they've ever had in their life when they're pregnant. And they just become obsessed with their blood sugar and making sure that it's perfect all the time.